talking about gastrointestinal cancer, there's an important group of cancers in our country as well. Well, when we talk about esophagus and stomach, a very high incidence in South India and Northeast India. Also, esophagus cancer and gastric cancer have very high incidence in Eastern Asia, including Japan, China, and of course India. Can we do anything about it? Well, the second group is the intestinal cancer, the colorectal cancer. Also, rectal cancer happens in younger men in our country. Curable subset of cancer which requires multimodality therapy. Colon cancer, which was supposed to be a cancer of West, now increasingly becoming a cancer of India as well. Dr. Venkatesh Babu will dwell about these 4 cancers and discuss in detail.
As you all know, a healthy diet is directly linked to our healthy life. The increasing incidence of esophageal or gastric cancers can be linked to increased incidence of increased intake of salty diets, increased use of processed foods and red meat. To avoid these cancers, we should practice healthy habits, which includes avoiding processed and high salted diets, and then we can avoid or limit taking red meat, and also we should include more fiber in our diet and more protein and good fats in our diet, and we should avoid alcohol or limit smoking. And coming to colorectal carcinomas, red meat is most commonly linked with the colorectal carcinomas, so we have to limit intake of red meat, and early detection will always give us better cure rates. So screening is an important thing when it comes to colorectal carcinoma. So those who are at average risk, that is there is no positive family history, no increased risk of colorectal carcinomas, we can start screening starting at the age of 50 years, and we can consider one of the following, that is either stool for occult blood every year, or sigmoidoscopy every 5 years, or colonoscopy every 10 years. Those who are at increased risk of colorectal carcinoma, that is patients with positive family history of familial adenomatous polyposis or HNPCC, we can start screening little early. That is, in case of familial adenomatous polyposis, we start screening at 10 to 12 years and we do colonoscopy every year. And for patients with positive family history of HNPCC, we start screening at 20 to 25 years or 10 years earlier than the index case in the family. Then we consider colonoscopy every 2 years in that case.